Hi, everyone. Thank you so much for joining us today for our CareConnect convo with Dr. Biren Patel. Dr. Patel works in the behavioral medicine department here at Kelsey-Seybold, and he earned his medical degree in 2013 from the Texas Tech University Health Sciences Center School of Medicine in Lubbock. He then completed his psychiatry internship and residency at UT Health Sciences Center at San Antonio. We are thrilled to have him with us at Kelsey-Seybold, especially as we start building our behavioral medicine department. So Dr. Patel, welcome, and thank you so much for joining us today.
Thank you so much for having us.
So do you want to give us a little bit of a background about yourself and talk a little bit about your practice at Kelsey before we dive right in to talk about mental health during the holidays?
Yeah, that would be very good. So, I am a board certified psychiatrist and child and adolescent psychiatrist working here at Kelsey-Seybold Behavioral Medicine. We are establishing a behavioral health network for initially our Kelsey-Seybold Kelsey Care Advantage plan, which is our Medicare Advantage plan. And so we have a variety of services, including medication management and psychotherapy with two of our therapists.
Wonderful. So let's dive right in. We know next week is a big week for gathering and getting togethers. Thanksgiving sort of kicks off the holiday season for a lot of families. We also know we're seeing a surge in coronavirus cases right now. And I know mentally a lot of people are worn down. So let's talk about mental exhaustion at this point that COVID has really worn down a lot of people. So what can you do to help prepare for the holidays if you're feeling worn down?
Well, that's a very good question. I think 2020 has been a year, like no other, and it is important to take care of yourself. So if you're noticing certain emotions, whether you're feeling down, stressed, anxious, it's okay to have those feelings, especially considering everything that has happened, and to work on ways to hopefully help yourself feel better. So some of those ways can be making sure you take time for yourself, excusing yourself, from overburdening with responsibilities or tasks. Also trying to make sure that you do things that kind of recharge your batteries, separate from your family or children or loved ones, just to make sure, you're feeling much better yourself.
So definitely setting up some boundaries can really help people during the holidays. Do you have tips for how to set those boundaries? I know a lot of people sometimes have difficulty having those conversations with family members.
Yeah, so boundaries are important with family members. I would recommend maybe trying to plan it out a little bit beforehand. So, for example, one boundary is about gifts, in which family members to get gifts for, not to get gifts for, especially, with the year we've had. I've read about some people will actually set an age. So maybe if you're like 18 and under, then you get a gift. But if you're over that age, then you kind of let those family members, either find, just find the reward in being, being here today, or let their family members take care of them for gifts.
So let's jump in and talk a little bit about the holiday blues. Is it normal for some people to become depressed or anxious during the holiday season?
Yeah, there is actually there was a disorder in the past called seasonal affective disorder. That's where, because of the daylight hours getting shorter, it's getting colder outside. Some people did have worsening of their depressive symptoms. Now it's actually a subtype of major depressive disorder. But the main thing is, if you do feel like the holidays have been tough, before in the past, try to find ways to help set up, things that will make you feel better, to kind of counteract, knowing that the nights will be shorter or longer and the weather will be getting colder, as well as, this year has kind of compounded maybe just a regular winter.
Absolutely. Are there some things we can do to help combat stress and anxiety? Are there any lifestyle changes that would be simple everyday things people can do?
Yeah, there actually are a variety of things that people can do to help yourself feel better. So, one of them can be having a routine. Even though the pandemic is here, still making sure you're celebrating birthdays, Thanksgiving, winter holidays, but maybe just more, digitally, like with video chats and, contacting family that way. Reaching out is another one. So, making sure you're still calling your friends or family, video chatting. There are a lot of support groups in the community, especially in an area as big as Houston. Other things can be exercise, even just walking around the neighborhood. Pets can help too with stress and anxiety, and other things as well, such as yoga. Try to limit nicotine and alcohol use, and making sure that you have good sleep hygiene, which means not watching TV in bed or taking work or electronics to bed.
What about caffeine? Can caffeine have an impact on your stress level or make you more anxious?
Caffeine can, and some people, if they do have anxiety, at baseline, usually you would just want to moderate your caffeine intake, not to go overboard with energy drinks and, espresso shots and things like that, especially close to the evening time or nighttime, because caffeine after lunch can sometimes go into the evening. And then if your sleep is disrupted, you might not feel that good the next day.
So let's go back a little bit and talk about, we have all these holidays coming up. We have a lot of people who want to gather with their families. What is the impact on your mental health if we don't gather with families? So are you sort of seeing, patients becoming socially withdrawn because of social distancing?
Well, I mean, there is a social component to depression, anxiety. So the social component can be when you do feel more down or more stressed. Sometimes you isolate and don't do activities like you used to, and so now that with the pandemic, it's kind of being told or forced onto people not to congregate or get into mass gatherings, but finding substitutes can help. So that's like we're either doing video chats. Some people do driveway dates. I've even seen in our neighborhood, for example, Halloween, they'll have, tables where things can be set out. So you can still see people from 6 feet away, or 10 feet away. But as long as it's outdoors and you have, appropriate distancing, sometimes that could be appropriate as well. And you may have to break up your social gatherings. So instead of having 50 people all at once, I've heard of some people doing like 4 people one day, five the next, just kind of staggering your friends and family. And that way you can still see them in a socially distanced manner.
We're a big fan of driveway dates here in our neighborhood. Our neighborhood does it every Friday night, where everyone brings a table and orders takeout or food, and everyone sits in their driveway socially distanced, and mask wearing even outside. And it's allowed us to continue that social interaction. And it's even allowed some of our neighbors who maybe we may not have met or may not have seen it as much if we were on our regular, hustle and bustle routine with kids schedules. We've been able to bond with them because everyone is home. So, just a little personal story there. The driveway
Mhm.
sort of dates has worked very well in our neighborhood, and everyone has come to look forward to them on Friday evenings. So,
Yeah, very good. And another thing that does help sometimes with stress, anxiety, feelings of depression is giving back. So with giving back, I know the holidays is a time of family being together, but a lot of times people do give back, to the community, whether it be, donation of clothes or things like that. I've actually been reading about some people will help make, food or, cakes, things like that for their neighbors, and just kind of delivering food to maybe those who may need help, or just a treat that that you're thinking about loved ones but from afar, just kind of leaving it for them on their doorstep.
so let's talk about anxiety with kids with the holidays. I know a lot of people are nervous how kids, especially maybe kids, who are a little older and know what to expect. You're age 4 to 10 and 12-year-olds, or even high schoolers, they understand the traditions. Do you have any tips to help them cope with the changes that are being suggested for the holidays?
Yeah, so with children, definitely being, honest with them. It's okay, if they're having feelings of either stress, frustration. Anxiety and depression presents a little differently in children. They can have more irritability or more withdrawal, social withdrawal. But being frank and honest, also try to manage your own anxiety or depression, using some of those activities before working with the children, because you wouldn't want maybe your stress, to compound maybe the child's stress. That can help. And then try to focus the holidays more on the traditions that were, established with the holidays. So, for example, some people have family traditions, certain, activities that they would do. Other times, going behind the meaning of Thanksgiving or the winter holidays, Christmas or uh, Hanukkah, just making sure that the children kind of know kind of where the tradition came from and know more of the historical background. That could be something that could be expressed this year.
So, with kids, is it important to set up expectations for holidays, especially with COVID?
Yeah, I think with children, letting them know that this is temporary. I know for a child, it might be a little harder to look out, a year, 6 months, from now, but this is just temporary, 2020 year for the books. And the more we do now, the better it will be, in the future. So having smaller gatherings or smaller parties, or maybe even combining gifts, like instead of separate gifts for 4 or 5 children, just one big gift, that they can all enjoy. Something like that might help. And letting, them know that the person is still coming first. The bond between the parent and the child is still there, even if social aspects or, other activities are impaired.
And let's talk a little bit about the big question. I know weighing on a lot of parents' minds is that we're going to go into this holiday season, and then, we're going to have a spike with COVID, and kids are going to have to transition back to virtual. Um, how can you talk to your kids about that transition? Um, and do you have any advice for parents on handling that transition if that were to happen during or after the holiday season?
Yeah, I think with parents, definitely those, activities we talked about, making sure parents are taking care of themselves, exercising, reaching out to family and friends, can help, but also keeping in touch with the school districts. So, making sure that if the teachers or principals make certain decisions, that the parents are, up to date with that information, just to make sure. There's a lot of information out there from so many different sources. And, making sure if the parents are in tune with the individual high school, middle school, or elementary school, that could help. Also, letting the children know now that, every day is a new day. We'll take it one day at a time. We have a term for that called living in the moment, where we really only have control over today, not yesterday or tomorrow. So, working on that principle with the children, letting them know, we'll take it one day at a time. In the morning, they may say home based, or they might say the schools are open.
So let's talk about symptoms of anxiety and depression. Do you have any advice or tips for, what you should be on the lookout for yourself and maybe in someone you care about, a family member or, a friend?
Yeah, so symptoms of anxiety and depression, there's some overlap with them, but depression can involve changes in your mood where you feel more down, depressed. It can also lead to not enjoying activities like you used to, feeling guilt or self-esteem changes, energy changes, feeling more tired and having trouble with concentration or focus. Your appetite can fluctuate, either stress eating or not eating enough, skipping meals, slowing in terms of your speed, and then thoughts of not wanting to be alive. So those are the symptoms of major depressive disorder. And anxiety tends to have more symptoms of feeling restless, not able to stop worrying or relax, feeling tense or on edge, irritability, which anger, with family or friends, and also having difficulty with sleep. That can happen with anxiety as well. So if you are noticing any of those symptoms, it's okay to let somebody know, whether it be a loved one, significant other, partner, family member. Ideally, you would want to talk about it with a primary care doctor
Mhm.
who could eventually, if the primary care doctor does pick up on the symptoms, refer to behavioral health or a mental health specialist. I bring up primary care just because more people have access to primary care physicians, and you're some people are more comfortable with the primary care doctor, so that's a good starting step to talk to someone about it.
And let's talk, what if you think someone is going to harm themselves? What should you do?
So if someone is talking about wanting to harm themselves, not wanting to live, we have two different types of suicide ideation. There's active, which means you're having a plan, wanting to hurt yourself, and you're going to go through with it, writing a note, that kind of thing. And passive, which is like, I would rather not wake up today, or I wish God would take me in my sleep. But I feel for most people, I would leave that up to a medical professional to make that decision between active or passive. So the medical professional could be 911, emergency room, could also be their primary care doctors, pediatricians, psychiatrist, therapist, just letting a medical professional know that they've been having these thoughts, and letting them know as soon as you can.
Perfect. So let's jump back and talk a little bit about, food during the holidays. It's a big part of holidays. We all love to eat. We all have traditions and recipes. Can changes to your diet impact your mood with stress and anxiety? Like consuming too much sugar or anything like that?
Yeah, I mean, there's a lot of talk about that in the news about certain foods that can make you feel better or not feel better. Um, typically having like a whole grain, vegetables, lean proteins that can help. Certain things, like if you do have caffeine, like sodas, or a lot of nicotine or alcohol use can definitely worsen the mood and worsen anxiety. So it kind of blurs it, but then after the alcohol is gone, you can have worsened depression or worsened anxiety. So there are some things you'd want to avoid, or at least use in moderation,
Mhm.
um, specifically the alcohol, or any cocktails or things like that.
Perfect. Well, we're going to go ahead and wrap up today. I know we're getting close to the end of our time with you. So we're going to open it up for questions. And we have a few people who joined us via Zoom. I'm sorry we weren't able to connect to Facebook. We usually have these live on Facebook as well, to take questions. But if you have any questions, we do have the Q&A feature and the chat feature at the bottom of your Zoom screen. So please feel free to type any questions you may have for Dr. Patel in there. In the meantime, Dr. Patel, can we chat about one more thing?
Mhm.
You know, there's a lot of anxiety with COVID right now. And I know, do we have any studies that have come up about the sort of, and I know we're not that far into this, but the long-term impact that COVID is having on mental health?
Yeah, I mean, there have been some studies that have come out, even from China, with the long-term implications of the pandemic, especially on people in healthcare, but
Yes.
even for the general public, whether if you had been infected or had a loved one who was
Mhm.
having the virus, it can cause depression or anxiety symptoms. The CDC had recently noted that anxiety occurs about 30% of the time in the US population, and depression, about 25% of adults have had a depressive episode. But with the pandemic, they're saying about 50% of US adults are expressing some type of symptoms of either anxiety or depression. So it may not be the disorder, but some symptoms here and there of anxiety and depression. So it is pretty prevalent. Another thing we didn't talk about is you can limit triggers for anxiety and depression. So a big one can be news. Sometimes the news is just 24-hour cycle. So try to do it more in the mornings, and then activities during the day to help diffuse the stress or diffuse the tense feelings.
Let's see, we do have a question that came in. Do you have any tips for getting family or friends to take mask wearing seriously?
Yeah, so with taking mask wearing seriously, everyone has opinion. Letting them know that the mask wearing is not just for their health, because a lot of times for your own health, if you're younger or you feel invincible, then it can be harder to convince. But letting them know what they care about. So, for example, if they care about their children, their grandparents, uncles, aunts, neighbors, whomever it might be that's close and dear with them, and if that person has any of the predisposing conditions like high blood pressure, diabetes, or medical conditions, then trying to pair, the social distancing and the mask with helping to protect that individual.
Perfect.
Mhm.
And then let's see, do we have any other? I thought we had one more that came in. I think that is it. A question about COVID testing. Um, I'm not sure Dr. Patel would be the correct physician to answer this one, but we'll ask him. Can you discuss the accuracy of COVID tests?
So the accuracy varies. I would defer to maybe primary care providers or in infectious disease, just because they have a little bit more research and experience with those tests. But the manufacturers may have that information online if you were able to just look into the manufacturer of that device or of that test, and then see what the sensitivity or specificity of that test is.
Awesome. And one thing, since testing was brought up, that we didn't talk about was anxiety related to COVID testing. Um,
Mhm.
do you have any tips on, relaxation techniques or anything like that that would improve the testing process for people who do need to be tested?
Yeah, so one thing that we use, even in our department or in our personal lives, is deep breathing. Deep breathing is kind of where you take a deep breath in through the nose, hold it for a few seconds, and then out through your mouth. And you try to do it without any music or distractions initially. But if you do it long enough, it becomes meditation. And so, with meditation, there are guided meditations that are available online through video streaming or smart apps. So, meditation is kind of like yoga, but for the mind. And so, that can kind of help make clarity, especially with all of the stress or all of the events of the day.
Awesome. Well, we're going to wrap up for today. I know that you need to get back to seeing patients. So thank you so much for joining us again, and to everyone who logged on. If you did miss today's conversation with Dr. Patel, we're going to send it out via email, and it'll also be posted on our social media sites and our web page. If you have any questions about COVID-19 testing or testing symptoms, you can also view information about that on Kelsey-Seybold's website on our homepage. The web address for that is kelsey-seybold.com. And again, if you have any questions or any concerns about mental health during the holidays, as Dr. Patel said, absolutely reach out to your primary care provider at Kelsey-Seybold. They're here to help you, through tough times that we may be in right now. So Dr. Patel, thank you again. And thank you to everyone who signed on with us today, and have a great afternoon.
You too. Thank you for having me.